In what is appearing to be a growing trend around the world, an Indonesian group is suing the government over their vaccine mandates. The lawsuit claims that the mandates violates numerous articles of their constitution. So we're going to discuss what is going on here. And so from Trial Site News, I am Adrian, and our episode is starting right now. So, an Indonesian group headed by Ted Hilbert and Fatoni Rahman is suing the government for the vaccine mandate involving the mass immunization of all residents of Indonesia by executive order. According to Hilbert and Rahman, the mandate goes against numerous articles of the Constitution of the Republic of Indonesia. The executive order issued on February 9, 2021 required every Indonesian citizen to be vaccinated if they were eligible. Health workers, other frontline workers, and individuals belonging to the high-risk populations, including those with comorbidities as well as those aged 60 years and above, had already been prioritized since 2020. The order outlines penalties that can be imposed on eligible individuals who are refusing to get vaccinated. These includes fines, a delay or cancellation of government relief benefits, and a delay of or disqualification for access to public services. The order also highlights that individuals who refuse to be vaccinated and thereby obstruct the government's efforts to control COVID-19 will also be subject to the applicable criminal charges related to the spread of infectious disease. In 2021, to encourage vaccination, the Indonesian government also barred unvaccinated individuals from entering public places or traveling between provinces, calling it a, quote, effective nudge. Now, while other countries are easing, if not foregoing, COVID-19 related travel restrictions, Indonesia last updated its requirements back in September of 2022. And what did they do then? They increased the domestic travel criteria from the primary COVID-19 vaccination course to also requiring a booster unless they held a medical exemption certificate. Importantly, while the COVID-19 vaccines have been touted by governments and leading health agencies around the world as having helped protect individuals during surges, durability challenges leading to breakthrough infections associated with the mutating virus began with the Delta variant and has only intensified since then. Today's highly transmissible Omicron versions, such as XBB, the vaccines, offer limited ability to stop transmission, which was one of the primary reasons governments around the world lauded their vaccine mandates as the savior for humanity. Now, the plaintiffs Hilbert and Rahman filed a complaint in September of 2021 to the Ombudsman Republic Indonesia, or Ombudsman IRI, about their multiple failed attempts to obtain data on the COVID-19 vaccines. When the Ministry of Health, or the MOH, denied the Ombudsman RI's official request for data on COVID-19 vaccines, the plaintiffs filed an administrative objection against the MOH, demanding that they stop all COVID-19 mandates. The objection was received by the MOH on January 31st, 2022 and was naturally rejected. As a result, the plaintiffs filed another administrative objection directed to the president that was received by the state secretary on February 22, 2022. This was also subsequently rejected. The team have since submitted a class action lawsuit against the Minister of Health and the president for intentionally spreading incorrect and false information about COVID-19 and its vaccines. The first hearing is scheduled for June 12th, and the group are welcoming more people to join as plaintiffs in their case. So what is the basis for their lawsuit? Well, the plaintiffs claim that the Ministry of Health's executive order violates the law on health, which gives every person the right to informed consent. This law also gives individuals the rights to have full access to information and data about health, as well as to informed consent about their own medical treatment. Therefore, based on Law No. 36/2009, the plaintiffs should be entitled to independently and responsibly determine the health services needed for themselves, as well as to obtain safe, quality, and affordable health services. Now, in addition to this, the plaintiffs conducted their own independent research on the effectiveness and safety of COVID-19 vaccines and concluded that while there are possible benefits for other groups of people, For them and most of the population, COVID-19's vaccines risks outweigh its benefits. Now, to bolster their point of view, they published an ebook entitled Complete Risk-Benefit Analysis COVID-19 Vaccine to consolidate their research findings. Here's what they claim to have found. First, the plaintiffs are claiming that they discovered that COVID-19 is not, quote, extraordinarily dangerous, as the government makes it out to be. It is only being used, this according to the plaintiffs, by the government to justify violations of human rights. They pointed out that the COVID-19 task force on June 5th of 2022 in Indonesia reported 157,000 COVID-19 related deaths since the beginning of the pandemic. Meanwhile, deaths from other causes amounts to about 78,500 a year. Now, the plaintiffs have added up all their evidence from their point of view, and they are claiming that their conclusions were that COVID-19 is not extraordinary as it is less dangerous than many other causes. Now, according to Johns Hopkins University's Coronavirus Resource Center, the case fatality rate in the United States is now at 1.1%, while mortality rates for influenza in the United States, according to Statista, can surge as high as 22.1% among the elderly. Now, the plaintiffs have also claimed that air pollution causes more illness and death than COVID-19. According to their study, there were 232,974 deaths due to pollution in 2017. Among those, 123,700 people died due to air pollution. Now, next, the plaintiffs are claiming that their research highlighted instances wherein officials or health practitioners have explicitly stated that the vaccines do not aim to stop infection. This argument, of course, centers on the vaccine's durability challenge. Now, one is Dr. Nadia Tarmizi, the Director of Prevention and Control of Direct Communicable Diseases, who said this: "So the vaccine prevents us from getting sick, not from getting infected." End quote. Next, you have another professor, Wiku Adasamito, who is an appointed spokesperson for COVID-19 handling, who said at a press conference back on December of 2022, saying, "Vaccines cannot prevent transmission. Transmission can only be prevented through strict adherence to health protocols and strict international travel policies." Meaning that to stop the virus, you would need a combination of pharmaceutical and non-pharmaceutical interventions, but by no means can the COVID-19 vaccines themselves control the pandemic or spread of SARS-CoV-2 in the endemic period. Now, another example used by the plaintiffs here was a statement by the chief of the Indonesian Medical Association COVID-19 Task Force, who tweeted on February 18, 2022, that the actual function of vaccines is not to reduce infection, but to reduce hospitalizations and deaths. Now, the plaintiffs also quoted a statement from the Ministry of Health on August 30th, 2021, which said in the research that vaccination does not make us immune, but it prevents us from being hospitalized. That's what we need to realize." End quote. Now, it is important to note that the unfolding science recognizes that the COVID-19 vaccines are not of the sterilizing type, meaning they don't stop transmission. They also mentioned that the Omicron variant thrives in countries with high vaccination and booster rates. They add that despite having the 44% of the population in Indonesia being vaccinated, 79% of Omicron cases are now in fully vaccinated individuals in that country. This led the plaintiffs to conclude that the fully vaccinated individuals are twice as likely to be infected with the virus compared to the non-vaccinated. This again, according to their lawsuit claims. Now, on top of all of this, they are claiming that the government itself is the ones spreading misinformation. In their research for the lawsuit, the plaintiffs pointed out that the government promulgated false information that does not reflect actual data. One example of this is when the vice president of Indonesia stated that the death rate among the children was 30%. This, of course, flies in the face of data from the Ministry of Health, which showed that it was below 0.2%. And then on top of this, you have the Indonesian Pediatric Society, which also stated that the death rate in children is somewhere between 3 and 5%, with Indonesia having the highest COVID-19 fatality rate among children in the world. But, according to Johns Hopkins University Coronavirus Research Center, Indonesia is nowhere near the top of the highest case fatality rates involving COVID-19. Now, the next claim that this lawsuit is asserting is that the data from early 2022 were analyzed to determine death protection rates on vaccinated population. According to the data, age groups under 50 years old have a higher risk of death after receiving the vaccine than the risk of COVID-19 death after testing positive on the unvaccinated population. So what does all of this mean? Well, the recent legal action taken by Hilbert and Rahman against the Indonesian government is showing that there are a substantial number of concerns surrounding the constitutional validity of mandatory COVID-19 vaccinations in a Southwest Asian nation. It is also another move by citizens at raising important questions on the protection of human rights and the role of vaccination in controlling or attempting to control the pandemic. The lawsuit's outcome could have far-reaching implications for public health policies and constitutional rights in Indonesia, which naturally means that we here at Trial Site News will continue to monitor the developments in this case as the debate unfolds and legal proceedings continue. And that, my friends, will bring our episode to a close once more. For more content like this, be sure to check back to this channel daily, Monday through Friday, or for written content posted every day, 7 days a week, feel free to visit us at trialsitenews.com. And as always, my friends, thank you so much for joining me on the program today. From Trial Site News, I am Adrian, and I will see you all next time.